Hello everyone. In today's topic, I would like to discuss you another national health program. So today I'll discuss mainly regarding cancer control program which was accomplished in India. So coming to the topic cancer, first of all you should know what is the cancer. Cancer means nothing but it is a disease where the abnormal cells divide uncontrollably and destroy the body tissues. So abnormal multiplication of cells in the body causing damage to the adjacent structures and the tissue itself is called as cancer cell. So here is an image which can show in which we can differentiate between the normal cells and cancer cells. Here these are the normal cells and these are the abnormal cells which were multiplying and developing uncontrollably. So these are the cancer dividing cells and they are resulting in the formation of tumor, and these are the normal cells. So coming to the stages of the cancer, so mainly a cancer is mainly staged into 4 types. We have stage 1 where the cancer cell is pertaining to a single cell, and in stage 2 the cancer it will spread through the single lung and lymph nodes. In stage 3 the tumor it is becoming extensive and it is spreading to the adjacent structures. In stage 4 the cancer it has metastasized throughout the chest, throughout the abdomen and throughout the neck and throughout the bones. So if you take in this picture here, for example, if you take a lung cancer here firstly a cancer cell is being developed in the pleura. So particularly in stage 1 it is pertaining to the only pleura. In stage 2 the cancer it is spreading to the single lung, means entire lung here is being infected, and from the lung it is reaching the lymph nodes. If you take in the stage 3 the tumor it is becoming more extensive and it is spreading to the lungs, means both the lungs it is spreading to the chest wall and it is spreading to the abdomen and chest cavity. So this is the 3rd stage. If you go to the 4th stage here the cancer is metastasized, and from the first in stage 1 it is in a single cell in a single lung, but when it comes to stage 4 it is spreading throughout the chest, throughout the abdomen, and neck bones are getting infected here. So these are the stages of cancer. So here we can see here, so first of all the tumor is localized and it does not spread to the adjacent cell. Here the cancer is spreading to the nearby organs, and in this 3rd stage the cancer cell is spreading to the nearby tissues, nearby lymph nodes and nearby organs, and in stage 4 the cancer had spread to nearby as well as the distant organs and tissue, lymph nodes. So these are the stages of cancer. Coming to the problem here, everybody knows that cancer is an important public health problem, mainly in India. So in an average every year there were about 7 to 9 lakh cases were occurring, and it is estimated that there were 2 to 2.5 million cases of cancer in the country at a given point of time. So in a particular time they have estimated that there were nearly 2 to 2.5 million cases of this problem cancer. So in the year 1975 to 1976 there was a program which was launched called as National Cancer Control Program. So the main objectives of this program are prevention, early diagnosis and treatment, and based upon the magnitude of the problem and gaps in the availability of treatment facilities across the country, means based on the incidence of the problem and what are all the facilities which were available in the country to treat the cancer problem, this program was revised. So as it was launched in the year 1975 to 1976, it was revised in the year 1984 to 1985. Again they have revised the program in December 2004. So coming to the objectives of the program here, so what are all the major objectives in the program? First one is primary prevention of cancers by health education. So by health education they want to prevent the cancer before it is occurring, and in secondary prevention they are going for early detection and diagnosis of common cancers such as cancer of cervix, mouth, breast cancer and tobacco related cancers by screening and self-examination method. And the last one is tertiary prevention, mainly strengthening the existing institutions and and giving them comprehensive therapy, which is including palliative care. So what is the primary prevention here? Before the disease is occurring to the patient, they are giving health education so that the patient is not going and falling in those risk factors. In secondary prevention, early detection of the cases, we have some self breast examination, self reproductive parts examination, so that for males, the male person has to self examine their reproductive areas, mainly the sexual areas. In case of females, the female has to go and self examine their breast, so that the breast cancers or any abnormal lumps can be detected as early as possible, and particular treatment can be given to those patients. In case of cervix and for mouth cancers and tobacco related cancers, we are doing proper screening so that the cancer is treated as early as possible and detected as early as possible. And in the tertiary prevention, mainly when the person is entering into the treatment part, mainly when he is going into the chemotherapy part, we are giving care including the palliative therapy. So there are several schemes which were revised under the program. First one is Regional Cancer Center Scheme. So in this Regional Cancer Center Scheme, the existing regional cancer centers are being further strengthened to act as a referral centers for complicated and difficult cases at tertiary level. So what they are doing here, whatever the existing facilities are there, whatever the existing equipment are there, they are mainly strengthening those. They are upgrading the facilities there, they are upgrading the doctors, they are upgrading the health personnel, so that whenever a referral case is coming from a PHC or any sub-center or any community health centers, there these people are able to treat those cases. So here, when the plan was started, one-time assistance of 3 crores was provided to the regional cancer center, and this funding pattern was approved by IRCH and the CNCI, which were located in Kolkata. And the other scheme that we are going to discuss is Oncology Wing Development Scheme. So Oncology Wing Development Scheme, the name itself is saying it is mainly focusing on the development of Department Oncology. So this scheme, it has initiated to fill up the geographic gaps in the availability of cancer treatment facilities in the country. So this program was completely central assisted, and the central has assisted in the purchasing of the equipment, which had included a cobalt unit besides the other equipment, and a part of grant can be used the civil work, but the manpower is provided by the concerned state government and institution, and the quantum of central assistance is 3 crores per institution under this scheme. So mainly coming to the scheme here, Oncology Wing Development Scheme, here there was assistance, central assistance which they are providing. So this central assistance, they are providing mainly 3 crores of rupees per institution. So they are helping in the purchase of equipments, as well as they are helping in the establishment of cobalt units besides the other equipment. And whatever the work, whatever the civil work is going, these are mainly given by the central government, but the manpower, it has to be provided by the state government or the institution. Another program is District Cancer Control Program. So it is known that the large number of cases can be prevented by suitable health education and early detection. So according to this scheme, for district process regarding the prevention, health education and early detection and pain relief measures were started in the year 1990-1991, since has been reserved. So here this program, District Cancer Control Program, it was launched in the year 1990 to 1991. It is mainly focusing upon prevention, health education, early detection and pain relief methods. Coming to the funding of this program, the funding of this program was mainly provided by the central government. So during the first year, means during the establishment of the program, the central government, it had provided about 22 lakhs of rupees per district. But after the first year, coming 4 years where they have given only the amount of 17 lakhs for the remaining 4 years of the project period. So After this 4 years had been completed, mainly first year they have given 22 lakhs, and after for next 4 years they have given only 17 lakhs, and after that the state government had required to take over the scheme, and the grant is released directly to the nodal institution and to be identified by the state government. Next one is decentralized NGO scheme. So this scheme, it is mainly meant for the IEC activities, early detection of cancer. So the scheme is operated by nodal agencies and the NGOs, and these NGOs are given financial assistance for undertaking health education and early detection activities of the cancer. Coming to the IEC activities at central level. So IEC activities at central level are introduced in order to give wider publicity to anti-tobacco legislation for discouraging the consumption of cigarettes and other tobacco related products. So you all know that tobacco, consumption of alcohol and consumption of tobacco and tobacco products, they are major causes for the cancer, and we have seen lot of people who are suffering with tobacco related cancers. Mouth cancers are there, and tongue cancers are there. So lung cancers are very common among these persons. So the IEC activities at the central level, they have launched an anti-tobacco legislation. This was mainly launched to discourage the consumption of cigarettes and discourage the consumption of other tobacco related products. Next one is creating awareness among masses about the ill effects of tobacco, and tobacco also be given about the rules being for implementation of various provisions of anti-tobacco legislation. Mainly they are creating the awareness. They are creating awareness in the people regarding the tobacco issues, tobacco causing diseases, regarding the mortality which had caused due to the consumption of tobacco, and regarding the morbidity which was caused due to the consumption of tobacco. When we are able to health educate the people, ultimately the goal is to reduce the tobacco consumption so that the cancer levels will get down, which were related to the tobacco consumption. Here in November 7th, so the November 7th, it was observed as a National Cancer Awareness Day in the country. Next one is research and training. So in this research and training, the program, it is mainly monitoring and research activities which were organized at central level under the scheme of training manuals, and they are developed under the NCCP for capacity building in cancer control district level, and manual for health professionals, and manual for cytology, manual for palliative care, and manual for tobacco cessation. So these are the research and training programs which have been implemented. Coming to the cancer atlas here, mainly it was under the National Cancer Registry program. So Indian Council of Medical Research, it has developed this cancer atlas, and it is mainly based upon the information which was collected from the years 2001 to 2002, which from 105 collaborating centers. Mainly they have collected the data from 105 collaborating centers, and they have created an atlas mainly based upon the information which was collected from the year 2001 to 2002. Under which program? Under National Cancer Registry program. Coming to the other program, we have tobacco control legislation. So mainly a comprehensive tobacco control legislation, they have titled the Cigarettes and Other Regulation of Trade and Commerce, Production, Supply and Distribution. So here in 2003, an act was passed in the parliament in the month of April, and it was notified in Gazette of India on 25th February 2004. So what are the important provisions of this act? Means prohibition of smoking in the public places. So no person should smoke in the public spaces. No one should cause any kind of disturbance for the public with the any kind of smoking or tobacco products. And the next one is prohibition of direct and indirect advertisements of cigarette and other products. So they should not advertise any kind of cigarette or any kind of cigarette causing cigarette related products. Next one is prohibition of sale of cigarette and other tobacco products to a person below the 18 years of age. So the children who are below 18 years of age are excluded from the sale means they should not the shopkeeper should not sell the products, or the person should not sell the products for the children who are under 18 years of age. Next one is prohibition of sale of tobacco products near the educational institutions. No person should sell the cigarette and cigarette products near the tobacco and tobacco products near any kind of educational institution. And next one is mandatory publication of the warnings. Mainly they have to include pictures also. So I will show you in the next slide here. So you can see in the tobacco cigarette pack here that they have to advertise that smoking will kill, consumption of smoking and consumption of tobacco and other related products will cause cancer. In such a way they have to advertise on the cigarette packs directly on the tobacco items. And they have created a mandatory depreciation of tar and nicotine contents along with the maximum permissible limits of tobacco packs. So this is regarding the National Cancer Control Program. So if you have any queries, you can drop it on the comment box. You can contact me through my WhatsApp and through my email. If you like the content, please like, share and subscribe. Thank you so much.